Hi, I'm Josh Dowd. I'm the Community-Based Palliative Care Medical Director here at Transitions LifeCare, and I wanted to talk to you a little bit about how palliative care can help patients living with heart failure. So, a really common question that comes up when we talk about palliative care is, what is palliative care? It's a new term for a lot of people. If you look up a definition of palliative care, you'll find a lot of different ones. A lot of them are very long. They're great, but they're very long. So the definition that I usually use for people is we're a team of folks who specialize in supporting people living with a serious illness. That's it. If you even need shorter than that, I think one word that describes us is support. If a cardiologist deals with heart stuff, a pulmonologist deals with lung stuff, a palliative care clinician deals with support stuff. The first time that we meet somebody, we like to get to know them as a person, get to know what's been going on, get to know what's been stressful so that we can figure out how best to support them. It could be physical stress, like symptoms or quality of life or functional changes. It could be emotional stress, psychological stress, spiritual stress. The nice thing about a specialty palliative care team is we've got a whole interprofessional team that can help support people dealing with lots of different kinds of stress. How can palliative care help patients living with heart failure specifically? There's actually been a lot of research done about how palliative care can help patients with heart failure. Some of the things that have been found is that palliative care can help improve quality of life for patients with heart failure, can help with emotional and physical symptoms, can help improve documentation of patients' preferences for their care, and in some studies can even help reduce healthcare utilization, so things like hospitalizations. There was one review that came out in the Journal of the American College of Cardiology Heart Failure Journal just last year about how and when palliative care can be most helpful. And they found that patients with a high symptom burden, so lots of pain, shortness of breath, other symptoms, patients dealing with a lot of psychological or spiritual distress, patients that have been hospitalized a lot, have a low quality of life or low functional status, and for people that have a lot of caregiver stress or caregiver burden can really benefit from palliative care. I think the nice thing about palliative care is, of course, we focus on the patient who's living with heart failure, but we also focus on the person's circle of care partners that they have. Care partners can hold a lot of stress, a lot of burden when caring for somebody with serious illness like heart failure. So we want to be sure that we support them too. I think one thing that's very important is everybody on somebody's heart failure team is already practicing palliative care to some extent. They're already trying to alleviate symptoms. They're already trying to help people feel the best that they can and support people. When a specialty palliative care team gets consulted, we're adding to the work that's already been done and is going to continue to be done by somebody's heart failure team. We are working to combine our strengths for the same common goal when we work together. What does it mean when people get referred to palliative care? If you're somebody living with heart failure, what does it mean if your provider puts in a palliative care consult? Really, all that it means is that they're seeing some stress that you might be dealing with where we might be able to provide additional support. It does not mean that they're giving up on you. It does not mean they have nothing else to do or no other treatments out there. It doesn't mean that they think that you're dying and they're just not telling you. It really just means that they're seeing some need, like what we talked about: physical symptoms, emotional distress, caregiver burden, and wanting some extra help to be able to take the best possible care of you. I think something that's really important is that people that get people that get palliative care don't die sooner than people who don't get palliative care. People don't live shorter with palliative care than they do otherwise. I think another thing that's really important is that if palliative care gets consulted, nothing about your treatment plan needs to change. Treatments don't need to stop. You can still go back to the hospital. You can still see your doctors. You can still do everything that you're doing at that moment. Palliative care is just providing additional support on top of that. The last thing that I want to talk about, just because it comes up a lot when we talk about palliative care, is talking a little bit about hospice. When is it time for hospice, particularly for patients with heart failure? A lot of people think that palliative care and hospice are the same thing, or they're kind of interchangeable terms. The way that I think about it is palliative care and hospice are part of the same big palliative care pie. All of palliative care, including hospice, aims to improve quality of life, wants to support people living with a serious illness, and wants to make sure that somebody's treatment is in line with what's important to them. Hospice is one very small slice of that pie that's for people who want to focus exclusively on comfort and want to prioritize that, and who may be nearing the end of their life. The guidelines are that we think you might have 6 months or less to live. If either of those things are true, either you're wanting to prioritize comfort or your clinicians think that you might have potentially months to live, it might make sense to talk about hospice. A very common thing that happens in patients with heart failure that might lead to a hospice conversation is if treatments that somebody's been getting don't seem like they're working as well anymore, or if they're starting to feel more burdensome. So a really common example is somebody's been in and out of the hospital a lot with heart failure. This last hospitalization, they don't feel any different coming out of the hospital than when they went in. And they're starting to feel like, do I want to keep doing this? Or this doesn't really feel helpful anymore. And maybe I want to focus on staying at home and trying to feel the best that I can at home. That's a really good time to talk about hospice because it could provide that additional support to be able to make sure that that plan of care is able to happen for somebody. For the rest of palliative care, non-hospice palliative care, people can have any goals, any prognosis, any hopes, can continue the treatments that they're getting. We're just aiming to support people living with heart failure and serious illness.